Is this the real fix for cataracts? I need to be honest with you from the start. Throughout my years studying eye health and working with patients facing vision loss, I've seen thousands of online claims promising to reverse cataracts naturally. Miracle eye drops, secret vitamin formulas, ancient remedies that supposedly dissolve cloudy lenses overnight. Some of these claims are misleading at best, dangerous at worst. So today, I'm not here to sell you hope based on hype. I'm here to investigate what the actual science says, what really works, and what's simply wishful thinking. I'm Dr. Ethan Walker, and my commitment is to give you the truth, even when it's not the answer people want to hear. Let me start by describing what I see every week in clinical practice. Patients come to me describing a world that's slowly fading. They talk about driving at night and seeing halos around every street light, the headlights of oncoming cars creating blinding starbursts that make them grip the steering wheel in fear. They describe holding books at arm's length, squinting under bright lights just to make out the words, frustrated that even new reading glasses don't seem to help anymore. They tell me about colors that used to be vibrant now appearing washed out and dull, like looking at life through a yellowed filter. And underneath all these symptoms, there's something deeper. A quiet anxiety about losing their independence, about becoming a burden, about the possibility of surgery and what that means. Here's what's actually happening inside your eye when cataracts develop. Your lens, that clear structure right behind your pupil, is made up of water and proteins arranged in a precise way that keeps it transparent. But over time, these proteins begin to break down and clump together, creating cloudy areas that block and scatter light. This process doesn't happen overnight. It's gradual, often taking years or even decades. The lens becomes increasingly opaque, your vision progressively blurs, and eventually, if left untreated, a cataract can cause significant vision impairment. What causes this protein breakdown? The primary culprit is oxidative stress. Every day, your eyes are exposed to ultraviolet radiation from sunlight, blue light from screens, and the natural metabolic processes that generate free radicals, unstable molecules that damage cellular structures. Your lens has natural antioxidant defenses, but these defenses decline with age. Other factors accelerate the process. Diabetes causes glucose to accumulate in the lens, leading to structural changes. Smoking introduces additional oxidative stress and toxic compounds. Chronic inflammation from poor diet and lifestyle creates a hostile environment for eye health. And certain medications, particularly long-term steroid use, can contribute to cataract formation. When I began diving deep into the ophthalmology research, I wanted to understand the biological mechanisms at the cellular level. What I found was both illuminating and, in some ways, sobering. The research is absolutely clear on one fundamental point. Once a cataract becomes dense and significantly impairs vision, surgery is currently the only medically proven method to remove it. There is no eye drop, no vitamin, no supplement that can dissolve an already formed advanced cataract. Cataract surgery, where the cloudy lens is removed and replaced with an artificial intraocular lens, is one of the most successful and commonly performed surgical procedures in modern medicine. This is important to establish because I won't mislead you with false promises. But here's where the investigation becomes more interesting. If surgery is the definitive treatment for advanced cataracts, the real question becomes, is there a scientifically valid way to slow the progression of early cataracts or protect the lens from developing them in the first place? This is where the evidence gets compelling. The lens of your eye contains some of the highest concentrations of antioxidants in your entire body, particularly vitamin C. The aqueous humor, the fluid that nourishes your lens, has vitamin C levels that are 10 to 30 times higher than what's found in your blood. This isn't coincidental. Your body concentrates these protective compounds where they're needed most. Vitamin C neutralizes free radicals before they can damage the delicate proteins in your lens. Multiple epidemiological studies have shown that people with higher dietary intake of vitamin C have a significantly lower risk of developing cataracts over time. Vitamin E works synergistically with vitamin C, protecting the lipid membranes of lens cells from oxidative damage. These two vitamins function as a team. When vitamin E neutralizes a free radical, it becomes oxidized itself, and vitamin C helps regenerate vitamin E back to its active form. Research has demonstrated that higher intake of both vitamins together provides stronger protection than either one alone. Then we have the carotenoids lutein and zeaxanthin. While most people associate these with macular health, they also accumulate in the lens where they filter harmful blue light and reduce oxidative stress. Studies examining lens clarity have found that higher levels of these carotenoids correlate with reduced cataract risk and slower progression of lens opacity. Zinc plays a crucial supporting role. It's a cofactor for multiple antioxidant enzymes in the eye, including superoxide dismutase, which is one of your body's primary defense systems against oxidative damage. Without adequate zinc, these protective enzymes cannot function optimally. Perhaps most fascinating is glutathione, often called the master antioxidant. Your lens naturally produces glutathione, and it's essential for maintaining lens transparency. As we age, glutathione levels in the lens decline, and this decline is strongly associated with cataract formation. While glutathione supplementation directly doesn't always raise lens levels effectively due to absorption challenges, supporting your body's production of glutathione through precursors like N-acetylcysteine and maintaining adequate levels of vitamin C and E helps preserve this critical defense system. If you'd like to learn which nutrients support long-term eye clarity, how to reduce blurred vision, and practical strategies to protect your eyes as you age, we've placed a detailed guide in the first link in the description. Now, let me be very specific about what the research actually shows. Large-scale epidemiological studies, including data from the Nurses' Health Study and other long-term population studies, have found associations between higher antioxidant intake and reduced risk of cataract development. People who consistently consume foods rich in vitamin C, vitamin E, lutein, and zeaxanthin show lower rates of cataract surgery over decades of follow-up. But here's the critical distinction. These studies show protective effects and potential slowing of progression. They do not show reversal of advanced cataracts. The most honest interpretation of the evidence is this: antioxidant support appears to help maintain lens clarity and may slow the oxidative processes that lead to protein clumping, particularly in the early stages. This means prevention and early intervention are where nutritional strategies have their greatest impact. If you're in your 40s, 50s, or early 60s and you want to protect your lenses from developing cataracts, or if you have early lens changes that haven't yet significantly affected your vision, optimizing your antioxidant status makes biological sense and has research support. But nutrition isn't the only factor. Lifestyle choices matter enormously. If you have diabetes or prediabetes, managing your blood sugar levels is absolutely critical. Elevated glucose damages the lens through a process called glycation, where sugar molecules bind to proteins and alter their structure. Wearing quality sunglasses that block 100% of UVA and UVB rays whenever you're outdoors protects your lens from cumulative radiation damage. Quitting smoking removes a major source of oxidative stress. Studies show smokers have 2 to 3 times higher risk of developing cataracts compared to non-smokers. Your diet beyond supplementation matters too. Consuming leafy green vegetables like spinach, kale, and collard greens provides lutein and zeaxanthin in food form, along with other beneficial phytonutrients. Fatty fish rich in omega-3 fatty acids help reduce inflammation throughout your body, including in your eyes. Reducing processed foods, excess sugar, and refined carbohydrates decreases systemic inflammation and oxidative stress. And perhaps most importantly, getting regular comprehensive eye exams allows early detection of lens changes before they significantly impact your daily life. This is about empowerment through prevention. We live in a culture obsessed with finding cures after disease develops, but some of the most powerful interventions happen before symptoms become severe. Protecting your lens from oxidative damage throughout your life is far easier than trying to reverse decades of accumulated protein damage once a cataract is mature. Let me return to the central question with complete honesty. Is there a real fix for cataracts? If you're asking whether there's a pill, drop, or supplement that will dissolve an already formed vision-impairing cataract, the answer based on current medical evidence is no. Surgery remains the gold standard treatment for cataracts that significantly affect your quality of life, and it's remarkably safe and effective. However, if you're asking whether there's a science-based strategy to reduce your risk of developing cataracts, slow the progression of early lens changes, and protect your vision long-term, the answer is yes, and it centers on protecting your lens from oxidative damage. This means ensuring adequate intake of vitamin C, vitamin E, lutein, zeaxanthin, and zinc, supporting your body's natural glutathione production, controlling blood sugar, protecting your eyes from UV radiation, eliminating smoking, reducing systemic inflammation through diet, and staying proactive with eye care. If your goal is to protect your vision, reduce cloudiness naturally, and understand what actually works for eye health, check the first link in the description for the complete science-based resource. I want to emphasize something crucial here. I'm not suggesting that you can or should avoid surgery if you have a significant cataract affecting your daily activities. Modern cataract surgery is one of the most successful medical interventions we have, with satisfaction rates above 95%. If your ophthalmologist recommends surgery, it's because the benefit to your vision and quality of life outweighs the minimal risks of the procedure. Nutritional support does not replace appropriate medical treatment when it's needed. What I am saying is that the lens changes leading to cataracts often begin decades before symptoms appear, and during that window, protective strategies have real value. The oxidative stress damaging your lens proteins today will manifest as cloudy vision years from now. The antioxidants you consume today, the UV protection you practice today, the blood sugar control you maintain today, these create a biological environment that supports lens clarity tomorrow. As someone who's reviewed thousands of research papers and worked with countless patients, I can tell you that the difference between those who maintain clear vision into their 70s, 80s, and beyond versus those who develop significant cataracts earlier often comes down to cumulative lifestyle and nutritional factors. It's not about genetics alone. It's about the daily choices that either protect or damage the delicate structures of your eyes over decades. The real fix for cataracts isn't a single miracle solution. It's understanding the biology, respecting the science, and implementing evidence-based protective strategies consistently over time. For early-stage lens changes, that means optimizing antioxidant status with vitamin C, vitamin E, lutein, zeaxanthin, and zinc, supporting glutathione levels, making smart lifestyle choices, and monitoring changes with regular eye exams. For advanced cataracts causing functional vision loss, that means trusting proven surgical intervention performed by skilled ophthalmologists. If this investigation has given you clarity about cataracts and what you can actually do to protect your vision, I invite you to subscribe to this channel. My mission is to bring you evidence-based information about eye health, separating legitimate science from marketing hype, and giving you the knowledge to make informed decisions about your vision. Your sight is irreplaceable. Let's protect it with truth, science, and practical wisdom you can apply starting today.